Welcome to our SCI forum tonight. My name is Jeannie Hoffman, and I am a rehab psychologist and a co-director of the Northwest Regional Spinal Cord Injury System here in the Department of Rehabilitation Medicine at the University of Washington. The forums, our video recordings, and all of our online media content are made possible by a grant from the National Institute on Rehabilitation, Disability and Rehabilitation Research. Excuse me. Tonight we are presenting actually the second of two forums on spasticity. Last month we had one of our physicians and an expert physical therapist and occupational therapist talk about a variety of medical and non-medical therapeutic approaches. And tonight we actually have four wonderful panelists who will be sharing information about their experiences with spasticity. We have Ian Ralston, Kenny Salvini, Aditya Ganapatharaju, and Brian Moore. Please join me in welcoming our panelists. So the first thing that I just wanted to review is just kind of everybody's injury level. It's very clear, I think, that we have a variety of different injury level folks. But let me just start with Ian. Ian was injured in 2010, and he has a C1 complete injury. We have, excuse me, Kenny Salvini, and Kenny was injured in 2004, and he has a C3-4 complete injury as well. Aditya is C4-5 Asia C injury, so an incomplete injury. And Brian Moore has a C6-7 injury, so all cervical level injuries. Really, for many of you, the spasticity didn't really develop for the first couple of months and really developed over that first year. So I want to start by just talking a little bit and having you guys tell me about kind of where is your spasticity at this point and kind of what are you doing? And I'll start with you, Kenny. So tell me a little bit about kind of your spasticity and what you do to manage it.
Well, you know, for the most part, my spasticity is relatively under control, I think. I've got some pretty good spasms in my arms and legs, kind of in the morning and the afternoon. And then later in the evening when I get into bed, my legs will do what I call river dance, and they start kicking all over the place for the most part. But, I'm on a pretty decent medical regimen that covers it for the most part. I think that, there's only a couple times a day when I start to kind of, the half-life on the medication starts to wane, then that's when it kind of builds back up. But as soon as I take my meds, I'm pretty much under control.
So tell me about what medications you're using at this point.
Right now I'm on 120 milligrams of baclofen and I think 24 milligrams of tizanidine as well. So we maxed out the baclofen probably within the first 6-8 months of my injury, I think. I think that may have been after I was discharged because it all kind of came about 3-4 months in. And then they supplemented with the tizanidine, and we've kind of leveled off there. Mm-hmm. And that's been kind of my medical regimen that I've had since probably a year or two out. So for the last 10 years or so, it's been kind of the same medications that I've used. So.
And that has kind of kept your spasticity at this kind of very consistent level. Yeah,
it's a manageable level. I don't know if, I haven't been one to really adjust my medications very much. I haven't really taken an inventory on all that. But for now, it's manageable. Mm-hmm. So, yeah.
Great. Ian, why don't you tell us a little bit about your spasticity and kind of what you're using at this point to manage your...
My spasticity tends to be fairly violent. I develop spasms throughout my arms and chest and neck during the day. It can be triggered by simply rolling over the lip of a carpet, and my arms can fly up, my head will lurch forward. Same in bed, except in bed my legs are more active, not so much in the chair. They've been pretty strong since about a year after injury. Been kind of titrating the medication upwards. Right now I'm on 30 baclofen in the morning, 15 in the afternoon, and 20 at night, which will probably end up upping shortly. But I also use some medical marijuana, which has proven to be quite helpful. I'll tend to take it at night so that I won't have to deal with the haze of the high during the day, and then it helps me sleep as well. I have difficult time sleeping. And then when I wake up during my morning regimen, my spasms are minimal, if not absent, and that tends to last throughout the majority of the day.
Tell me a little bit about kind of how you came to using marijuana. Is that something, I mean, my assumption is that was not recommended by your VA physicians.
No, the government does not condone the use of marijuana, but I had seen a few articles on the news about seizure patients who had been using medicinal marijuana, and it had almost entirely eliminated their seizing episodes, and so that prompted me to look into it a little further. And through the community, I've met a couple guys that have tried it, and they've had good results, so I decided I'd step in and try it myself, and I can attest to its effectiveness.
So how did you go about getting, how long have you been using it? It's been since before it became legal in the state of Washington?
No, I started using it after 520 was passed, but the medicinal marijuana has been illegal in Washington for quite some time before 520. Since the VA will not write a script for it, I was at the time going to a chiropractor for my neck pain, and he recommended a doctor that would write me a prescription for it. And then after that, it was just a matter of finding a dispensary at which they were knowledgeable and helpful. The first place we went, they were not. It was pretty much the typical stoner that was helping us out. The place we go to now, they're very well educated and very helpful in helping us select items. There are a few items that work consistently for me, but I'm still trying out other items as well.
So how often do you use it? Do you take a dose similar to like your baclofen, or how often are you using it?
The product that I use is more like a Tootsie Roll. So you can't really dose it out, and since it's not governed by any like U.S. pharmacopoeia or anything like that, there isn't a whole lot of strict standards in the product. Sometimes it's hit or miss, but for the most part, what I've been taking is pretty reliable, and so I'll take it a few times a week. I try not to take it all the time so that I don't build up a resistance to it, or not necessarily resistance, but a tolerance. Yes, that's the word. Thank you. And so I'll take it a few times a week at night, and it just depends on how bad my spasms are during the day, whether or not I decide to take it, or if I haven't been sleeping well that week, will be another reason that I take it.
Okay. Probably have more for you later. Brian, tell me about your spasms and kind of what you've done in order to manage your spasticity.
Well, my spasticity really started to develop about the time I was leaving the hospital, which was 2 months post-injury. And it seemed like the more medications I was taking, the more my spasticity increased. And it got to the point where I was taking a full dose of baclofen, of tizanidine, of dantrolene, and it just wasn't doing it for me. So I went the route of the pump, and it was about a year after injury when I got the pump implanted, and it took probably close to a year after that to get the dosage worked out to a point where it was effective for me. But now I've still got some spasms, but I'm not a wet noodle, and I'm not bouncing around and flying out of my chair anymore, so I think I'm in a pretty happy medium.
Mm-hmm. So how did you go about making that decision? When we talked, you mentioned that that surgery wasn't something that you were interested in initially.
Well, I mean, I'd heard about the pump during my inpatient stay, and it was just kind of that seed planted in the back of my mind. But you know, it just sounded very invasive, and I wanted to avoid it if at all possible, because you know it's a big hunk of metal in your gut, and you've got a catheter wrapped around your body going into your spinal column. It's not the most exciting idea, but at a certain point, it needed to happen if I wanted to have any sense of independence at all.
So has that really changed with the pump?
Yeah, it completely changed everything for me.
Give me some examples.
I mean, I needed help doing just about everything. My spasms were so bad I couldn't, transferring. I was, kicking my chair all over the place. If I twist the wrong way, I'd end up going over backwards. So once I got the pump, I was able to start doing everything independently, start driving, really take control.
So do you consider yourself kind of fully independent now?
Yeah.
Yeah, able to do everything on your own?
Yep.
Yeah. So you mentioned that it took almost a year to get to kind of your current dose. Why did it take so long, and kind of what do you think about that process?
I mean, they're very conservative with the amount of baclofen that is going straight into your spinal column, which makes sense. So it's a matter of just slowly building up, so you're not at risk of any further problems, any overdose issues. So it's just a matter of finding that sweet spot, which is different for everybody.
Yeah. Now, tell me a little bit about how they do decide whether you're a good candidate for that or not.
There's a trial. You go in and they basically just inject you with a shot of baclofen and see if it works or not. And that was a pretty great day for me. Everything finally quieted down for the first time ever, and I was able to do all sorts of things that day. And then that was really clear at that point that I needed to get the pump.
Yeah. So your surgery was relatively uneventful.
Yeah, it was really straightforward. Easy rehab process, and that was all good.
Yeah. So one of the things you mentioned is that you don't kind of have a consistent dose.
Right.
Tell me a little bit about that.
So my dose is I have a flat rate, and then every 4 hours I get a spike, which keeps everything down. I think that bolus really is what does it for me. Based on the idea that during the trial I got one large spike of baclofen and it calmed everything down. While I was first trying to ramp the dose up, we were just increasing it at a flat rate and I wasn't having any luck. So we decided to do this spike idea, and that really made a difference for me.
So you have kind of this background continuous, and then every 4 hours you have a little extra.
Yep.
Okay. So how did you guys come up with that? Is that something that's standard?
I don't think so, but I could be wrong. Aditya's nodding. So
flex dosing, and yeah, it's for the same reason why you think it's effective in your case, and because so you have a basal rate like this baseline rate, and with each bolus, the idea is sometimes people react to that because they don't get their sensitivity stays intact, and so that's great to hear that it worked real well for you.
So we'll transition to Aditya, who's also a pro at the baclofen pump.
Yeah.
Tell me a little bit about your spasticity. I think you're probably the most incomplete of the folks up here.
Yeah, and so again, my spasticity became most noticeable in the couple months, and especially like the weeks before I was about to be discharged, which was almost 6 months after I got injured. Even back then, this was in 2002, that was considered a really long stay, but I just kept getting sick, and that was my backup plan to not get kicked out. But they caught on, and then as a final kick in the shins, my spinal cord decided to just spike on up with spasticity, and I'd already been on the highest dose of baclofen, and I'm super sensitive to all medications, and so that was turning me into a zombie, and I couldn't really function. Even the starting dose of tizanidine completely sedated me, and I wasn't acclimatizing to that, and so I stayed with that, and even using Valium at night, a small dose, for a while, but the most problematic part, and this went on for a couple of years, the most problematic part, besides the functional limitations, like the same type of things that other folks experience, my feet would fall out of my chair or spasm, or during transfers, they'd kick out, or it'd be hard to try to hold things. The extra tone would make you really rigid, would affect your posture and the way you're breathing. The most problematic part, the part that impacted the quality of life for me most significantly, was when I was supine, when I was laying on my back in the middle of the night several times, my knees would spontaneously come up with my hip flexors. So my knees would come up to my chest and then kind of plop over to one side, which is painful, and obviously it woke me up like 3 or 4 times a night. And so I didn't really know what else to do about that, and so finally I did consider the baclofen pump when folks brought that up as an option. And so after trying all of the medications that are first-line treatments like tizanidine, dantrolene, benzodiazepines like Valium, etc., I finally did get a trial for a baclofen pump. Like Brian said, as soon as I got the injection from in anesthesia, my legs were fairly supple and not rigid anymore, and so it was go time. And so then I did have the surgery in November of 2004, which is just about 2 years afterwards. And things were just smooth after that for maybe like a month, and then not ever again. So then I had a lot of complications related to the skin on my back. They have to make an incision to put your baclofen pump in, and then like Brian said, there's a catheter that goes around, and another incision's made near your spine where there's a smaller catheter that goes inside your spinal canal that has a little catheter. And so the point being, I was really thin at the time, like many people are after they've been laying in bed for 6 months. And my posture, I had the typical C5 quad posture where you're, rolling and tilted back and really kyphotic. Your back is bent. And so that led to 4 more visits to the OR to revise the surgery sites there. But those were problems related to the surgical part. In terms of treating the spasticity, it seems like my nerves would not go without a fight, and they still don't. And so every time we shot some more baclofen at him, they'd sass me right back. And it's kind of, it's like a duel to the death now. They really do not like being told to calm down. And so despite baclofen, my baclofen right now intrathecally is it's around 1,300 mics per day, which is really high. Most people aren't over 1,000.
I'm a little over 900.
Yeah, so I've gone up to like maybe 1,500 at one point, 1,500, which is when I stopped breathing so well. So then I got to turn it down a little. And with this, I've tried the oral medications again, and not so much luck. It's managed now in that I'm not falling out of my chair. One, because I have a seatbelt, and 2, I have straps around my ankles. That's a big part of it. But I'm not transfers. Like Brian said, transfers are easier now that I have less tone, but I still have way too much tone to actually move my legs. They are a bit evil because the tone in them keeps them really stiff. And so in terms of physical mobility, that's where it's at now. It's not a simple story, but definitely the pump has made a huge impact in terms of my mobility and independence and not being woken up 4 times a night. That's pretty big. And so, but that doesn't mean it's managed well in that sense. There's still things that are left to be desired.
Yeah, I mean, I think for all of you, you still have some issues with spasticity. Nothing has gone away. I think, Aditya, you struggling the most with trying to figure out how to get through this in a different way. I'm curious, actually, Brian, to go back from something Aditya said, side effects for you for Aditya with the pump. Obviously, he had some of the issues just related to the surgery, but in terms of kind of the oral medications, you also had that same issue of that as you took medication, it seemed like the spasticity just went higher. But did you also have some of the feeling like you're getting knocked out, the too fatigued, too tired from?
Absolutely. Yeah, it was really tough to keep my eyes open. I mean, I couldn't make it through a full day. Just feeling like a zombie, not feeling like myself, and I hated that. So, I mean, that was another reason that it was an easy decision once we found out that the baclofen worked.
Absolutely. Kenny, how about you? You've been on this regimen for now quite a number of years. Do you feel like you have side effects to some of the medications that they're talking about?
Oh yeah, I definitely still do. I usually take my meds around like 10, 4, and 11, and usually about an hour and a half later, I'm doing this number in the middle of a conversation with people. But usually it only lasts for about 5 or 10 minutes for me. I'm sure somebody else might argue that it might last longer. I'm not sure. But, for the most part, I have the medication times laid out. So most of the time it's when I'm in the car on the way somewhere, ends up giving me a little 5-minute nap, something like that. But for the most part, I don't have,
And certainly not the level, obviously, that these guys are
Yeah, I
talking
haven't
about
felt
with
like a
the oral
zombie or
medication.
anything like that. It's just more of a forget a few pieces of conversation with people, and that's about it.
Yeah. How about you, Ian? With your baclofen, do you notice any of those side effects? Or have you been on, is your dosage low enough where you've been able to?
I'm pretty sure my dosage is low enough that I've been able to avoid that. But with some of the PRN medications that I take, like Flexeril, Valium, sometimes that'll put me down.
And what do you use those for?
Depending on how bad my spasms are, I might take some of that. But I usually take it for my neck pain, which is pretty intense most of the time.
Is your neck pain related to your spasticity, or is it something different?
It can be, depending on how painful my neck is. It can elevate my spasms. But my neck's pretty much in a constant state of pain. Just can never get it in the same position every time I get in the chair. It's a little different. And so it's one of those things I've kind of learned to live with and try to medicate and mitigate as much as I can.
Absolutely. Kenny, do you have any pain related to your spasticity? Or spasticity triggered by pain?
I don't think so. I think, I've got much more manageable levels of pain compared to a lot of the folks in chairs that I've met. For me, sometimes my spasticity, I work to my advantage. Like if I can use it positionally, if I fall too much forward, I can trigger a spasm and it'll the tone will push my arms and kind of push me back in the chair. So it's, I've kind of figured out ways to kind of turn it on its side and make it used for something I can do.
Yeah. How about you, Aditya? Pain? Does your spasticity lead to pain for you?
When a few years ago, actually, ironically or paradoxically, as I became more physically active and started exercising more, because the left side of my body is more incomplete than the right. It's more intact in that I can use it more, and the left side of my back can pull up a little bit. Right now it's being Botoxed. Actually, that's another med that I'm using in my back, not this. The lumbar and paraspinal muscles that are in my lower back, as a result of getting stronger, have also kind of started doing their own dance, on their own. And so as of 4 or so years ago, when I started exercising more and getting more fanatical about that, they've become more noisy in terms of neuropathy and nerve pain. And so usually antispasmodic medications can help that, like clonazepam or diazepam or lorazepam. But that's leading to a whole another field of treatment, pain management. But it's very, very much related to spasticity. If I took a lot of benzos and my spasticity was completely subdued for the moment, then that pain would be,
Subdued as well.
largely removed. But so would my ability to think,
Yeah.
or yeah.
So it's all that difficulty of just the sensitivity to medications and trying to
Yeah.
balance all that out.
Yeah.
Brian, for you, have you had pain with your spasms?
No, I haven't found a connection between pain and spasticity. There's been two separate issues for me.
Yeah. Great. So, Adichie also bring up that other question I wanted to ask all of you guys, and Brian, I'll just start with you. What are other things that you tried along the way? You mentioned a variety of oral medications, but I'm curious in thinking about last month's forum about other kind of treatments. You just talked about Botox and blocks or phenol blocks or Botox blocks, other kinds of treatments or therapies or things like that. What else have you done or what have you tried in the past or what are you using?
Yeah, I did the medicinal marijuana thing for a little while, and that was cool, whatever. I mean, it didn't really help me as much as I wanted it to. I found the biggest thing for me is just staying as active as possible. My spasticity kind of builds up when I sit still. That's when I really feel it throughout my whole body, throughout my trunk, throughout my legs. But when I can stay moving, everything feels the happiest. So I really just try to stay as active as I possibly can.
So what kinds of things do you do to stay active?
Well, I've gotten into hand cycling recently. Play on the Seattle Slam wheelchair rugby team. I mean, anything. Just going up, pushing around the block, go find a hill to go push up, go lift some weights, whatever it is. I mean, it all helps. Getting out of the chair, moving around. Motion's kind of key to a lot of things I've found.
Okay. So Adichie, you mentioned that you're doing some Botox right now. Had you done other blocks as well, or is this your first trial of using?
No, I've used it for a couple of years now. Botox, a few hundred units in my lower back, and I'm doing everything possible. Not really, mostly because I'm just like, we're just throwing everything we got at it.
Yep.
And so the only thing I'm not doing are things that are knocking me out or have clear detrimental effects, like medications that I'm too sensitive to. But so there's Botox. I use a massager on my back. I stretch to one side every night before I get into bed, and use lidocaine patches on my back, which all of these things may or may not help. I know that if I don't do one of them, or if I accidentally forget my clonazepam, it's a bad day the next day. Like if it gets stuck in the pill box, there's other things, a heat pack, and I'm probably forgetting a bunch of stuff, but exercise and activity has another paradoxical role in my spasticity and pain.
Yeah,
in that, for me, it's always better to exercise more, but typically that exacerbates things, and I'll have more pain the next day. But on days when I don't exercise or can't, if I have shoulder problems, it's definitely worse the next day. And so being able to exercise at the hand cycle or a stationary arm bike at the gym or any sort of cardio activity has been really huge in terms of, one, releasing that overall sense of well-being you get from consistent exercise, and two, making a psychological sense of being able to feel empowered again and active and not kind of passive bystander in your health and your life.
Kenny, how about you? What are other things? So you kind of have your medication regimen down, but what about activity? What about other physical therapy or other kinds of things have you tried? Or
Me and Ian get together, lift weights. Unfortunately, we don't have enough function that we can do the active exercising, but I found that the range of motion does lessen the spasticity. Do I do very much of it? No, not really, because I'm just kind of lazy. But it's another one of those things where if the occasion arises where I am more spastic than usual, then I will have somebody, range my arms or my legs and just kind of, hold some tension against it, and it can kind of work it out. But I've tried the benzos, I've had the prescription for Valium and all that stuff, and it's, you get way too far into zombie mode, and I can't remember. One of my buddies gave me a few of the weed pills. I've tried like one or two, but I haven't really, really explored it that much. So, for the most part, it's, but like Aditya was saying, it's kind of taking care of everything else. It's, get enough sleep and, eating right and all that stuff that kind of, if you feed the machine properly, it's going to behave a little bit better for you. So.
Now, did you mention that you also did a seating evaluation and changed your seating at all? Did that affect your spasticity?
Yeah, well, I mean, if you're sitting on your chair wrong, your body's definitely going to let you know. And I've spent probably the last 3 years sitting on my ride cushion a little bit incorrectly. And, that was one of those situations where I had to make a change. And since I've done that, I have little to no issues again. And so it makes it a lot easier to kind of go through your day without having too many issues. So.
Ian, how about you? What other things do you do? Range of motion, other kinds of activities?
Range of motion helps. Mostly just if you can get me to spasm enough during range of motion to exhaust the muscles. Sometimes it can help. I have an RTI bike that I use way too infrequently, but that does help.
Can you explain what an RTI bike is?
And it's a kind of like a stationary bike that you pull up to, strap your feet in, and then you place electrodes on the thighs and the buttocks, and they trigger the motion to pedal, and it helps cardiovascularly and just works the muscles as well.
Mm-hmm. So kind of tires everything out a little bit?
Yeah, it can. And I mean, if you do it, when I was rehabbing in the Minneapolis VA, I was doing it 1 hour, 3 times a week.
Uh-huh.
So I was in pretty good shape back then, spasm-wise. And then as you get out of the clinical setting and into the home setting, things kind of drift away from that. So it's something that I do need to get back into. But yep, it helps.
But that can make a difference.
Actually, I did get another thing I tried or did recently for foot spasticity. Both feet, after so many years, had started pointing down in plantar flexion and pointing in and curving. And so even though they looked very neutral, meaning, in a right angle, I was having pressure issues under my toes, in my shoes. If I wasn't wearing the right shoes, it'd be painful. Even if I was wearing the right shoes, it would be painful. And so a few years ago, a physician recommended that I see the foot and ankle surgery folks at Harborview to see about getting a tendon lengthening, a tendon lengthening surgery, as well as tendinectomies, cutting the tendons that are under my toes to let the toes kind of straighten out. I no longer have the kind of problems that are associated with 10 years of spinal cord injury with really a lot of spasticity and tone in your feet. And so that's another thing that's available for everyone.
Yeah, that's
All of
another
you can
thing
get
that we hadn't really talked about is other kinds of surgeries or other things like that. So that's great.
Yeah.
So Ian, you mentioned that you don't really have much benefit from spasticity, that it's still just kind of, that you still have enough where it kicks up now and then, but it doesn't really have much benefit. And Brian, I don't think you mentioned that you had much benefit from your spasticity. Kenny, you have some.
Yeah.
You mentioned already today, anything other than kind of being able to trigger getting into the chair, moving back into the chair?
One more thing for me, I think, is when I'm in bed and I kind of feel the need that I have to get a cough, I can actually time a spasm with a cough, and it'll actually kind of tense up the abdominals too, and it'll give me a little extra boost that's come in handy when I get a cold or something like that. So that's one of the things that really helps.
Yeah. And Adichie, I know you actually get some benefit with your hand function, right?
Yeah, and also that same cough, I can muster up a slightly better than quad cough, and that helped just a few months ago, or a month ago, when I had a slight respiratory thing. The first time in like 10 years, I was able to cough up little invaders.
Yeah.
But my hands actually, it's not typical. The clonus type of spasticity is just annoying, and it doesn't help anyone. But the tone, the stiffness that I have in my fingers is actually really helpful for not just day-to-day things, but like being able to, I could pick this up, but once I get something around my hand, I have a little bit of grip. Oh, it's already worked out, so it's failing, but I have a little bit of grip, so it'll hold it. But it also helps in like activities or like holding my handles on my hand cycle. It like adds a bit of strength that I don't really have, and as well as things day to day like opening doors, being able to pull levers or lift dumbbells or all sorts of things throughout the day. So the extra tone and tightness I have in my hands definitely helps in several ways all throughout the day. Yeah.
So I'm curious about whether any of you guys, given kind of where you're at this point, I mean, you all have relatively stable regimens at this point, although you mentioned that you might be going up a little bit on your baclofen. Are there other things that you've thought about trying, or have you considered trying, or are you kind of feeling like it's working and so don't necessarily mess with it too much? Ian, how about you?
For me, some of my spasms, they've increased a bit within the past year, and so that's the reason for wanting to up my baclofen. But other than that, I'm pretty happy with where I'm at.
How about you, Kenny?
Well, just hearing about the foot surgery that Adichie had, that seems like a viable option for me. But other than that, I'm not in enough pain to change what I'm doing right now. I think pain's one of the biggest motivators for me, and if it's working for me now, I just kind of stick with it.
Yeah, absolutely. How about you, Adichie?
Yeah,
I mean, it sounds like you're trying anything that anybody mentions.
Yeah, mostly because I still need to address some stuff. So.
How about you, Brian?
I'm in a pretty good place right now.
Yeah, that seems like. So, Brian, what advice would you give to people who are relatively new or just starting to deal with spasticity?
I mean, tackle it with an open mind. Try and stay as active as possible. I think that's a big component. And then, try and, get your sleep, eat right, try to do everything as organically as you possibly can. And then start throwing drugs at the problem as kind of a last resort. And then surgeries after that, I mean, try and keep it as simple as possible.
Yeah, absolutely. How about you, Adichie?
Yeah, I think sometimes a lot of the fundamental things that you need to take care of to ensure your health get overlooked when you're trying to treat spasticity or pain or other aspects that are come up from spinal cord injury.
What's your advice, Kenny?
Similar to these guys, I'd say keep an open mind, but also learn your body. The more you learn about your body, the better you can advocate for yourself. And be vigilant, and don't take one doctor's opinion and take that as fact, because I've learned a long time ago that I'm the expert with my body, it's all of these little things that you get to know. Like, I remember when I first was injured, I would get a spasm in my right shoulder, and that would be a signal that I needed to tilt or do a pressure release. And it's all these little things, these little triggers that you can find that, they're really hard to see, I think, when you first become injured, because you are so focused on what you've lost that you can't see what you have. But I think the more you kind of, with time, you get to know your body a little bit better, and you can find out the strengths too, aside from the weaknesses. That just the little things that figure out how to make these annoyances work for you.
There you go. How about you, Ian?
I really don't know that I can add much. Listen to your body, definitely. I mean, for me, I can tell what different spasms, different locations where they emanate from. That can be a warning sign to me as to whether I need to be tilted or if I'm getting sick or something like that. Stay healthy, eat healthy, do everything you can to just learn yourself and drive on.
Excellent. In terms of advice for people if they want to try marijuana?
Just get out there and try it, honestly. I mean, there's a wide range of effects. It varies from person to person, and what works for me may not work for Kenny. So you just got to kind of play with it. And I've never done a drug in my life before spinal cord injury, and it helps me, but like I think Brian said, it didn't help him at all. So you just got to experiment and find the dosing, what works. There's different components to marijuana, and you need to pay attention to the level of certain cannabinoids, CBD and THC, and they can help in different ways. So just get out and try it if you're interested. And for me, I can only ingest edibles. And so for these other guys, they could potentially like vape it or smoke it if they chose to. They both provide different types of highs, whether you eat it or smoke it. And then just the level of THC kind of determines what kind of fog you're going to be in afterwards. And so you just got to see what works for you.
Yeah, absolutely.